Hi, I'm Danielle Lynn, and I am here with Mr. Allan Barsam, and he is one of the top eye surgeons in the UK, and I am so excited. I saw you in the magazine, the article, and I have to tell you, it's such a personal, I think a personal surgery, and very scary for people to do eye surgery. And after looking at just one image that you brought forward, I felt like, wow, to be able to see that clear would even be amazing to me. So I know you have an animation that you're going to show us. So thank you for being on the show.
Thanks very much for having me, Daniela.
Yeah, so what have you brought to show us, and tell us about the kind of work that you do?
Sure, so I specialise in laser eye surgery and lens implant surgery for vision correction. And it can be used for anyone that has nearsightedness or farsightedness or astigmatism or that's developing problems with reading vision. It can also be used for people that have got a combination of these problems. And like you say, people are understandably nervous at the idea of having it done, but it's an incredible operation for these people if it's done by the right person with the right technology, and very liberating. People no longer need glasses and contact lenses and can get on with their day-to-day life without needing any of that, with perfect vision.
Has it changed? Because it seems years ago you couldn't do the same things.
Yeah, it's changed enormously. So people first started to do a lot of these techniques in the kind of late 80s and early 90s. So we have at least 20 years of data and research and understanding to know that it's safe, to know that long term there are no problems with it. But the technology has increased enormously, especially in the last 5 years. And so the technology that we use in order to deliver laser eye surgery is like never before. It's like space age technology, basically, and it allows us to achieve fantastic results.
Okay, let's take a look.
So the procedure is completely painless. It normally takes about 20 minutes to do both eyes. And the first thing that happens is that a tiny, very thin flap is created in the cornea. I use a laser to do this, so it's very high precision. It's 1/10 of a millimetre in thickness, so you wouldn't be able to see it with the human eye. And it's just gently reflected back and out of the way. And then underneath, a second laser will reshape the cornea in keeping with the patient's prescription. Typically for a patient that's -5, this will take, the laser I use takes about 25 or 30 seconds to do this. And we then put the flap back into position and it's all done. We move on to the other eye. The next day, patients have 20/20 vision or better in almost all cases. And nowadays, people now talk about lunchtime laser eye surgery or lunchtime LASIK, so they can have the surgery in the morning, be back at work in the afternoon.
It's unbelievable to me. Okay, thank you so much. I'm excited and I want to learn more about it. And if you want to learn more, you can go to myfacemybody.com.